At Temple Health, I worked in the at Fox Chase Cancer Center division, responsible for just making sure that the patients were taken care of in a timely manner, making sure that schedules were good for patients because when you're dealing with chemotherapy, the doctor's appointments in oncology, it's very serious. No 2 days are the same. One of the things that I loved about working at Fox Chase Cancer Center was the ability to connect with the patients. I had patients that would see me every day, and we would just talk, and I would cry with them. I had one patient, a gentleman, when I first started 2 years ago there. He always commented on my shirt and tie combination. And the one day he said to me, "Oh man, I really like that tie." So as I was headed to my meeting, being a Christian that I am, I said, "You know what? I'm not sure how long he has to be on this earth." So I took the tie off and I gave it to him. And he said, "Oh, for me?" And I said, "Mr. Such and Such, yes, absolutely. You take it, you enjoy it. I want to see you in it." And unfortunately, he passed away. But it was relationships like that I built with patients and my team, my staff. It was a tense time, because although COVID struck us all, cancer care doesn't stop. Patients still need chemotherapy. We transitioned to televisits, even for those patients that needed to come in to see a provider. Obviously, we had the proper protocols and screening set up to allow patients to come in and see their providers. You're talking about a hospital that's hustling and bustling with thousands of people. To when COVID struck, it was like a desolate. It was like a desert. You would see just a few people. They would come right in for chemotherapy. It was almost like it impacted everybody. I had to send staff home because we just didn't have the work volume for them to keep up their daily duties. No visitors, patient only. So it didn't matter if the person came all the way from 5 hours away and the wife or the husband is waiting. We were not allowing visitors into the waiting room. The stress that it played with my staff. I had staff, if they were sick, they were just automatically calling out. You were afraid to cough, especially being in a cancer hospital, everything is magnified. So, it really was a stressful time for me because I had to show up every day. And to show up every day, knowing that I was putting myself at risk, and I have a wife and 6 children. I have a daughter. My oldest daughter had like 101 or 102 blood transfusions. She wasn't supposed to see past like a month or two old, and she's about to be 22. So God is good. We have another son who's asthmatic. So that was very tense because I always said to myself, what am I bringing home? I considered living in a hotel, especially during the onset, because I just wasn't sure. And I really didn't want that on my shoulders. I stayed in prayer. I asked God to cover me. I worked in a mask, and we had surgical masks. So at the time, I never forget this, I got so paranoid because we were short on PPE. And I knew I had to go to work. So I mean, they had, the hospital had protocol. They were taking the surgical mask and cleaning them and sanitizing them, sterilizing them, getting them back to us. It was a whole process around that. It was so frustrating wearing a mask, or it's not. I'm used to it now, but at the onset, because I have sensitive skin, so the fibers from the surgical mask constantly like just made me itch, and I was just always scratching, and my nose would itch, and it was tough. You went through the whole rubber glove syndrome, and then you realize, hey, you know what? Rubber gloves make it worse. The best thing you could do is constantly wash your hands. Um, I never forget this. One of the environmental services people would steal the hand sanitizer I had in my office. So I had my own little bottle. I had two in there. One I had already when I had, left Ensign Health to go to Fox Chase. And, you pack your box up. I put that in the box. And I kept it. Then it was one in the office. And, thank God I had it. But this person was stealing them. And so my anxiety was on like 10 because I'm like, oh my gosh, well, I need to wash my hands. So, I mean, my hands would be raw from washing them so much. And it was a little tough for me because I was in a motorcycle accident in July of 2019. And so going through the healing process, my skin still, even present day, it hasn't, really formed. And so this stuff was just, the soap was drying my skin out. It was just tough. But I just knew that I had to still go in and provide for my family. Being that, quote unquote, the breadwinner in the house, I have to make sure that, my wife and children are able to sustain the lifestyle that we have as best I could.